just in LaCrosse, family practice. I like the challenge of medicine. I like the science behind it and the challenges that it creates. I like dealing with people and working with people as far as there's the science and the nerdy side of things, but there's also kind of the idea that you have to work with people and their personalities and understand where they're coming from. In order to do that, you kind of have to understand their story of what makes them who they are and what makes them individuals and what's important to them so that you can best come up with a treatment plan for them and figure out how to best handle their situations when they arise. So I think that's an important thing and why I went into medicine was to hear people's stories and to hear what makes them unique and what's important to them. I'm from the area originally, so this is kind of home for me, and I always wanted to practice close to home because I think there's something unique and special to be able to practice medicine in a town that you grew up in, an area that you grew up, so that was always important to me, so that was a big driver to me, and I like the small town feel, like small town medicine, and just kind of like the clinic that we have here. And there's been a few occasions where certain people come in and they recognize the name from the area or remember who my grandparents were, or grew up with my dad growing up or something like that, where they have ties to the family or recognize the name. And so I think that's kind of neat to be able to hear the stories that all these other people have of my family and of the area growing up, that it's something that I don't think I'd have elsewhere or be able to hear those stories anywhere else. I think it's important to have the yearly appointments and to see us on a regular basis, because even though things may be going well, there might be certain early on signs that something might be starting to come up, or that there may be issues starting to arise that we can address early and intervene early so that they don't turn into bigger snowballs down the road. My approach is that sometimes the best thing is to not rock the boat and to leave well enough alone, and if it's not broke, don't fix it. And sometimes that's hard for some people, but you do get certain people who haven't been to a doctor in 40 years because they're afraid of what they're going to hear, or what a little bit of workup is going to find, and there's a hesitancy as far as why people don't want to go to the doctors, which I get it, but on the same token, it's a lot easier to treat a lot of different things early on than waiting until they're out of control. I think the main thing I'd like patients to know is that I'm not necessarily going to tell you what you need to do, but more so partner with you as far as trying to achieve the goals that you have for yourself and for your own health and well-being. I'm there to kind of give my recommendations and the medical literature input on things, but ultimately it's a decision between patients and myself as far as how to best proceed and what the goals of care are.